I'm Governor Jay Inslee. The next 30 minutes are going to allow us to focus on the opioid crisis in our state and highlight some of the ways the state government and others are working to address this health emergency. In 2015, each day an average of 2 Washingtonians died from this crisis. In fact, opioid overdose deaths are now the leading cause of accidental deaths in nearly every part of the state, surpassing motor vehicle deaths and even firearm-related deaths. This is a tragedy that we can reduce. That's why I've asked some state agencies and experts and other leaders from across the state to come together to develop a formalized plan. Washington State's response to the opioid public health emergency. In this plan, we've committed to prevention, including changing prescribing practices, ensuring on-demand access to treatment medications, and offering high-quality counseling and social supports, and overdose reversal through the use of naloxone. The truth is, everyone can play a role in helping our friends, neighbors, and loved ones address opioid abuse and misuse. It starts with one. When it comes to preventing opioid misuse, the one who can make a difference is you. I hope you enjoy this informative program. I hope we can keep moving forward together on this. There's no more better work we can do in the state of Washington right now.
Thank you, Governor Inslee. It does start with one, and with the help from healthcare providers, communities, and local governments, we can build practices and policies to prevent opioid-related overdoses and deaths. Hello, everybody. I'm Jeff Humphrey, and I'm joined by our guest panel. For the next 30 minutes, we're going to be discussing our commitment to prevention, treatment, and overdose reversal here in the state of Washington. Our panel consists of leaders and experts in the field of opioid prevention and treatment. Our goal is to discuss some of the ways the state of Washington is working on addressing these critical issues. So let's meet our panel. Dr. Caleb Banta-Green, Principal Research Scientist, Alcohol and Drug Abuse Institute, University of Washington. He's an opioid use disorder treatment expert. Dr. Sharisa Fotinos, Deputy Medical Chief Officer, Healthcare Authority and DSHS. Julia Havens, Prevention Systems Implementation Manager for DSHS. And Christy Sharp, Certified Prevention Professional, Community Prevention Coordinator with Clarkston EPIC Coalition. So let's go to our first question. You heard the governor talking about what a great problem this is for our community. Help us get on the board with this. What is an opioid?
An opioid is a type of a class of medication that's used primarily to treat moderate to severe pain. Opioids naturally come from a particular type of poppy, and they can also be synthetically made. Most people will recognize them as drugs like codeine, Vicodin, hydrocodone, oxycodone, morphine, and heroin is also an opioid. And I think most people are very familiar with the fact that they're used to treat pain, but people may not be as familiar with some of the side effects and problems that they can cause, which is part of why we're having some of the struggles that we are. And those side effects can include things like confusion, leading people not to drive safely. They can cause severe constipation. They can cause people to be sedated. And most importantly, they can cause people's breathing to slow down and stop, which is an overdose. So while they do have benefit in circumstances, they can also be very dangerous, and it's important that we understand how to use them properly.
And these drugs are certainly intended to help us recover from our injuries, but what about an opioid makes it so ripe for abuse and misuse?
So there's a couple of different things. Our bodies are hardwired to respond to opioids. We have an endorphin system, and what that word means is morphine that our body naturally makes. So we already have a system that involves receptors and an opiate-like product. The issue is when you take an opiate from outside that can be much stronger and has a really strong effect, people respond in different ways. You can't really predict. And for some people, it ends up being something that they end up using over and over and over again, and that can lead to problems that Dr. Fotinos just mentioned.
We know that the governor is very well aware of this. In fact, the state has a response plan. It's such a big deal. What is that about, and what type of progress are we making?
So the response plan has 4 parts. The first part is really prevention, which is what we're going to be talking a lot about today, and that's making sure that when an opiate is prescribed, it's prescribed in the right circumstance to someone who really needs that to treat their pain, that patients and the public understand when it's appropriate to both get an opioid or even ask for one. So the preventing extra opiates from being out in the community is sort of the other piece of that. The second part of that is helping to recognize people who've developed a problem with opiates, whether that's misuse, abuse, or an opiate use disorder, really helping to find those folks, direct them to treatment. We have treatment that works. This is a chronic medical condition. It can be treated just like diabetes, heart disease, or asthma. So really helping identify folks and get them into treatment. The third piece of the plan is to help people who are at risk of overdose, people who may need to take them after a surgery or something, have medications that can reverse an overdose if they in fact have one, a medication called naloxone. Making sure that people who struggle with opiate use disorder have that available, or people who are with them have that available. So if they do have an overdose, they can reverse the effects of their slowed or stop breathing. And the final part is really, we need to make sure that we measure what we do so that we know that what we're doing is effective. And if it's not, we need to redirect our efforts. And so the state has been working on this for about 2 years, and there are a lot of activities in each of those buckets that we're trying to do to help, impact this crisis and reduce the burden and the impact it has on the families in Washington.
And this is really an emerging public health issue, and it's making headlines around the country, but is it really that serious a problem here in Washington State at this point?
Yeah, we've had more than 10,000 people die in our state over the last 15 years. So we have right now we're at a point where about 700 people every year die of an opiate-involved overdose. That's about 2 people a day. None of those need to happen. So the end of the road is death, but upstream of that is opiate use disorder. And we have tens of thousands of people in our state who have opiate use disorder, and most are not able to access right now really effective treatment that supports recovery and prevents death.
So why do you figure this has become such an emergent crisis for our community, for people across the country? What is it about the opioid that makes this something that we didn't really see coming, but now it's a big deal, we got to deal with it?
That's a really complex and complicated question with many layers. And I think probably thinking about it from the prevention perspective, the sort of way in which makes the most sense to explain is that for a long time, providers, doctors were really worried about the effects that opiates could have, and were really very reluctant to prescribe them. About 20 years ago, there was some research that came out that suggests, well, maybe we shouldn't have to worry about the side effects of opiates as much as we thought we did. And there was also a lot of people who were suffering unneedlessly from cancer pain or horrible pain. So the medical community took sort of a different turn and said, maybe we're not prescribing enough opioids to help people. So it became more acceptable to prescribe them, and people became more used to having them for pain. And I think the other thing is we've sort of developed into a culture where you watch TV and it's an ad about a pill for this, a pill for that, a pill for this. And so we sort of developed this mindset that we can take a pill and cure pretty much anything we have, when in fact pain is a useful cue for our body. It helps us know when we should stop, slow down, or do something differently. So I think it's a combination of a lot of things.
You know, I think we're getting much better about monitoring our health, and we know about diabetes and how to prevent cancer and what our cholesterol level is, but we really need to throw ourselves in and get knowledgeable about this as much as we are. There's a disorder, opiate disorder, and you need to know about it like all those other problems that could affect you.
Right. I think what's really important that people understand is what is opioid dependence and what is opioid use disorder. And I'm going to break that down a little bit. So opioid dependence, it happens when a person takes opiates over and over and over again. If all of us take opiates 4 times a day for the next month, we're all going to be dependent on opiates. And what that means is that if all of a sudden we stop taking them, we'd go into withdrawal and feel bad. What's different, though, is that opiate use disorder means that your use is out of control and chaotic. And so in that instance, yes, a person has physical dependence, and the reason they have physical dependence and the reason they continue to use is that they're trying to avoid withdrawal. But what happens is in the brain is that our brain chemistry literally changes. You can see on brain scans that people's receptors actually change in their brain in the course of opiate use disorder. And what that actually looks like behaviorally is people's literal priorities in life change. They change from things like love, food, sex, important things for human beings to survive, to opiates. Opiates become number one. It becomes preoccupation. You think about it all the time, you crave it. It's a psychological component of opiate use disorder. And you can imagine if you have to use opiates all the time, and you're thinking about nothing else, that it's going to really destroy your social life, that it's going to destroy your relationship with your friends and your family and your job and school. So opioid dependence is the physical part. Everybody gets that. A small but substantial proportion of people get something different called opioid use disorder. And what matters, the distinction matters, because when you have opioid use disorder, the frontline treatments, the most effective treatments, are treatment medications. And some of those medications actually keep a person opiate dependent. But instead of injecting heroin 4 or 6 times a day or smoking fentanyl multiple times per day, you take a medicine by mouth once per day under the supervision and under the coordination of a medical provider. And in that instance, the person moves out of disorder. They no longer have the psychological and social dysfunction, or at least they can start addressing that because the physical part is dealt with. And that person can move into recovery. And the added bonus is that those medications dramatically reduce your chance of dying from a fatal overdose by at least 50%. So the fundamental thing we want people to understand is the difference between physical dependence and opiate use disorder. And the implication is, and that when you treat opiate use disorder, in some instances a person will be on a medication that will keep them dependent, but you've gotten them out of the chaos. It's the disorder, it's the addiction. That's what we're trying to manage.
And it would be a terrible mistake to think that this is just a problem that's affecting one segment of our communities.
Absolutely. So we've seen this all across Washington state. Those 10,000 people are distributed all across our state. It's really a horrific map to see 10,000 different people who have died in our state. It's the northeast part, the southeast state. It's from Clarkston to Neah Bay. It's everywhere in our state.
Christy, everybody here on the panel agrees that prevention is the way to go. You're very good at that. You're working out there on the front lines. What type of things are giving us a good level of prevention? What can we do more of?
Yes, thank you. I work primarily with youth and families, and one thing that we're really seeing amongst our youth is increased anxiety, depression, suicidal ideation, and stress. And so we're really working with our children as to how to cope with these different things in healthy ways. We know from research that kids tend to turn to drugs and alcohol when they are living in stressful situations and are struggling in different areas. And so we're really working to help build their resilience and teach them how to cope with stress. We also use many evidence-based strategies to help them cope, as well as media campaigns and public education. We really want to get the words out to parents as how they can keep their kids off drugs and alcohol by really focusing on what are your kids' strengths and helping them build their talents and their competencies so that they have some self-confidence. So when it does come time and they're offered a drug, they have the confidence to say no, and that they can make healthier choices for their life. And I just think it's really important that each and every one of us possess an ability to make a difference in a child's life, and that never underestimate the power of one, because if we can love and support our children better, they're going to have a brighter future.
Christy, being a teenager in this day and age is more stressful than ever before, and you worry the stress that our kids are feeling, that lends itself to this opioid addiction problem.
It absolutely does. We're finding that a lot of kids live in really stressful environments, and that home can be so important as to whether or not a kid thrives or whether or not they find themselves in trouble. So we're really working with families in our community to really help them be able to communicate in ways that are effective, and also so that parents can truly bond with their kids, so that their kids feel comfortable when they have problems and issues that they can come to them. And as parents, we need to be able to react in a way that is calm so that our kids can feel comfortable sharing what's on their hearts and minds.
You worry that unless we create a safe and welcome environment that is as stress-free as possible at the house, that we may be begging this problem in the future.
It's stressful to be a parent, but I think sometimes we don't understand how stressful it is to be a kid. And I think just acknowledging that with our kids is really helpful, and also modeling how we respond to stress as a parent. What is it that I do when I'm super stressed out? Do I go for a walk and put on my favorite music, or do I reach for a bottle? That speaks louder than any words you could ever say. So if we can teach our kids healthy ways to cope with the stress that they're dealing with on a daily basis, we're just creating a brighter future for those kids.
So our kids pay so much attention to what we do and how we handle life's daily stresses. And you're worried if they see us reaching for a bottle every time something has gone south on us, that modeling behavior is going to be transmitted to the kid, who's going to think it's okay to take pills to fix your problems.
Absolutely, and it can be contagious too. Once one kid starts using it, they tell their friends, and the word gets out, and then it becomes a thing. It becomes a trend, and that's definitely what we don't want to see.
And because our kids are at risk, this is on the governor's radar. There's a number of state agencies that are wrestling with this problem right now, but you can't just rely on the state. It really has to come from the community level as well, Julia.
Community involvement is very important, and anyone in the community can take action, from an individual community member all the way to a community coalition who's focused on this issue. So one of the ways that we've tried to work with this right now is to roll out a campaign that'll start statewide, a media campaign called Start With One. And there's information that will be targeting young adults, parents, families, and older adults and elders to help shed light on this issue in Washington State, on this opioid crisis, as well as bring awareness to what opioid misuse and abuse is, and educate on safe use, safe storage, and safe disposal. So one of the ways that you could get involved is to go to getthefactsrx.com and download the Partner Toolkit. And the Partner Toolkit has information in it that you can download, that you can print and distribute in your community, including things like posters and card racks and rack cards, and things that you can post on your social media accounts that are public. And so you can use this information to distribute it in your community in the very best way and help everyone to learn about this issue.
Julia, the campaign is It Starts With One. What do you mean by that?
There's something that every single one of us can do. There's simple steps that we can take every day in our lives to address this issue and be part of the solution. You can go to the website, getthefactsrx.com, and learn more about the opioid crisis in our state. That's one thing that you can do that will help. You can also access that same website for talking points to discuss this issue with your kids, with your teenagers, with those young adults that are going to college or in college age groups, and really talk about what they need to know about not sharing prescriptions, about taking medicine as it's prescribed and appropriately, and really ways to learn about how to take advocacy for yourself when you're talking to your prescriber if you have a minor injury or a dental procedure. Those are things that we can do to talk with our children and teach them early, so as they grow and if something happens or if they get their wisdom teeth extracted, they can have that intelligent conversation with their dentist or their doctor or their nurse practitioner who's prescribing. So those things are very easy and simple. Sometimes the conversation is hard, so that conversation starter online is going to be really helpful for folks, because we're used to talking about all kinds of other drugs, but opioids might be a new one for folks, like you just said. So I think that can be something that people could do really easily. There's other things that you can do. Lock up your medications if you have them at home. Prescriptions should not be left on the counter. They shouldn't be in open cupboards in your bathroom or in your kitchen. Those places are easy for people to get to, and they know where people tend to keep medicines. If you have a visitor to your home that you may think you even know really well, they may have the ability to access those and take those prescriptions from you. And they'll end up in the wrong hands potentially. So lock up your meds, put them in a storage container that locks, so that could be a cupboard that locks, a cabinet, a filing cabinet, a desk drawer, or even your safe at home.
Julia, there's a lot that we can do individually to resist this type of addiction and prevent it, but there's also things that we can do as a community to prevent this problem. Tell me about that.
Absolutely. So we have over 64 coalitions throughout the state addressing alcohol, tobacco, and other drug issues in the communities. So there is a local community coalition most likely near you. So you can go on that getthefactsrx.com website and find out where there's a coalition that you can engage with. If you want to do more and join a group of people who are really working on this issue and others around alcohol and marijuana, you can go and be part of the solution and learn how you can help. And it may be something that you love and really enjoy doing as a volunteer, and that's a great way to use your voice.
It's very easy for people to stay away from heroin, you know what that is, but if you're in a car crash or you have an accident on the ski slopes, these opioids can enter your life for good reasons, but possibly go bad. So what, as a person, do we need to know about this problem to ward it off?
Well, I think as we've talked about, really understanding when it's appropriate to use an opioid medication. They're powerful, strong medications. We use them to treat people who are dying of cancer. So that says, well, maybe we don't need to use them for a sprained ankle or a bruised knee. So really being better educated about these are powerful pain medications, and they have significant side effects, the most important of which is is stopping breathing and dying. So I think that we have to help people understand when it's appropriate to use opioids. We have to help also make available other alternative treatments for pain. And I think that's some of what Christy spoke to, and really helping to understand some amount of pain we're going to have. Our bodies have pain and respond to it, so we stop doing what we're doing, or that we say, gosh, maybe I should get this checked out. This is not a normal feeling. But the illusion of trying to eliminate it completely is probably not realistic. So better understanding what opioids can and can't do, and that they are in fact dangerous. We should treat them much more carefully. We don't have a test to know who's going to take an opioid and develop a problem with it. And until we do, we have to be respectful of the power of those medications, not just to treat the pain, but to cause significant problems and disrupt our lives and kill those we love.
And those people we love include children. This can really suck in kids from all spectrums of society. So what do we need to know about children and preventing them from developing an opioid disorder?
Well, there's several different things, but if you think about the first step that has to happen is in order for a person to go down the path of opiate use disorders, they have to use opiates. And there are two main things that have to happen. They have to have access to opiates. So as we're talking about is preventing inappropriate initiation. We don't want youth to start opiates if they don't absolutely need to. So we want to prevent that path from even being a possibility. The other option, the other component of that is that if a person is offered opiates, we want them to say, no, thank you. We want them not to use, and that's complex. Certainly it has to do with peer pressure. I think it really has to do with what Christy was saying is we're trying to build up resiliency. What does that really mean? We're trying to give kids a toolkit that when something stressful happens, I know what to do. I have 3 options or 4 options that they've actually thought about this and practiced it and built up that toolkit. And those might be things, I'm going to talk to a friend, I'm going to talk to a family member, I'm going to listen to music, I'm going to exercise, these types of things. And way at the bottom of that toolkit, and that toolkit is the one that the doctor is the one that should be dispensing, is the medication. That's really the last resort. And I think what's important to understand is we think about this as about physical pain, and it is, but it's also about emotional pain. It's about emotional distress. And that's a big piece of this. And frankly, it's hard to know what pain always is, whether it's physical or emotional. And opiates can feel like a temporary fix, but it is a temporary fix that oftentimes is not going to lead in a good direction.
And because sometimes these pills come to the hands of our children because we have them in the drug case or grandma and grandpa have them, parents and grandparents really need to be aware that these drugs left out there where the kids can find them just as dangerous as leaving a gun out there on the coffee table.
Parents and grandparents play a very strong role in this. And we know that a majority of the people who develop the opioid misuse or opioid use disorder start with a prescription. It may or may not be theirs, but we know that there is things that can be done in the home and conversations that can be had with our teens and young adults. One of those being talking to your teens about not sharing prescriptions with their friends, and to have a conversation with them about how to talk to their doctor about what other alternatives there are to pain management. Those are very important things that people can do to take an active role in reducing the amount of opioids in their home and that their children and their teens and young adults have access to. Some of the other things are to lock them up when they're at home, and when you're only limiting access for the person who's taking that prescription, you're making a lot of important moves to keep that safe. And then dispose of that prescription when you're finished. And so those primary things are things that parents and adults can do, along with accessing the website and learning more about how to talk to your children, and important conversations to have are very important.
I guarantee you I've got some old pain pills in the back of the medicine cabinet that I just didn't need because the doc did a great job. You're saying if I'm leaving that stuff around, even if it's in the back, that I'm just inviting a potential disaster to anybody who's in my house.
Yes, and we would encourage you to not keep those medicines around. As soon as you're done taking them, you should dispose of them. One way to learn how to dispose of them properly is to go to getthefactsrx.com. There's information there for families who have prescriptions in their home and how to dispose of them.
Both the city and the county, the law enforcement agencies in town, they're helping these boxes pop up at those public safety building. Pharmacies are into this now. So just thinking that putting it in the trash is going to take care of the problem. It's not good for our sewer system. Don't put it in the toilet. And ideally, it would be taken to one of these safe disposal locations that you're aware of.
Yes, and if you need to find out where a safe disposal location is, you can go online to takebackyourmeds.org, and that can direct you to a zip code locator to find one near you. There's also take back events that might be hosted in your community every 6 months or so that are in cooperation with the DEA, and those are anonymous events. You drop off the medications with the law enforcement and the folks there, and they're disposed of properly and in the right way. But again, do not keep those medicines at home. That just opens up opportunity for them to be accessed by other people.
And finally, we mentioned how as parents we've been very good about talking to our kids about drinking and driving, and we go through a lot of steps to make sure that doesn't happen, including locking up the liquor cabinet when you're away. You're saying we should treat opioid addiction with the same type of energy and restrictions. Don't let them drink and drive. Don't let them pop pills and drive either.
That's right. You should make sure you have that conversation with your teens and your young adults to make sure that they're monitoring, you're monitoring their prescription use if they have a prescription, and that they don't share prescriptions and that they don't take other people's prescriptions. It's very dangerous and has negative consequences.
Doctor, given the extent of the problem, it just stands to reason statistically that we probably know somebody, our friends or family, that are struggling with this type of addiction. If we suspect that, what should we do about that?
The first thing is to not judge that person. That's most important. We often say stigma kills, and we mean that literally, that people are so ashamed of their substance use disorder that they're afraid to ask for help. And that really can lead a person to isolation and can lead to them actually dying. So the first is to understand to treat another person well and as a human being, no matter who they are and from whatever walk of life they come from. That's fundamentally important. I actually think it's the most exciting thing about working in this area around addiction is this recognition that we're all human beings. We all could be susceptible to this, and let's be respectful and treat everybody well. So within that, if we do know someone who we suspect has opioid use disorder, everyone needs to understand, this is so widespread, I believe everybody in our state needs to understand that opioid use disorder is a medical condition, that it is a treatable medical condition, that the most effective treatments are treatment medications. They're not right for everyone, but they are the most effective treatments, so people should learn about those treatments, that those treatments support recovery. As I mentioned, when a person has opioid use disorder, they're in chaos. Some of those medications can keep a person physically dependent but out of chaos, and that supports recovery, and it also dramatically supports people's life savings in terms of overdose risk is being cut in half. People can find out about what are the options, explore what things might make sense for them. Are treatment medications a good option? What sort of social supports are available? Counseling and so on. A great place to go is the Washington State Recovery Helpline. They have staff there who are trained in how to talk about this and also how to refer people to effective treatments that are most likely to be working for them.
And because opioid addiction can be so inadvertent, this should not be something that you should feel bad about or ashamed about. It could happen to anybody, particularly if you're predisposed to this type of problem. And so cut them some slack and help them, and don't be down on them for this. It could happen to any of us.
It can literally happen to anybody.
Very well. Well, you guys, thank you so much for your help with our panel today. I've learned a lot from you, and I hope our viewers have as well. This is going to wrap up our special on the opioid crisis happening nationally and right here in our local communities. As our panelists have noted today, the truth is everyone can play a role in helping our friends, our loved ones, and ourselves with opioid misuse and abuse. For more information on this relevant and impactful issue our country is going through right now, you can go to getthefactsrx.com. That's where you'll find a toolkit you can download. Take the time to learn more about this public health crisis. Everyone can play a part, and we need your help in bringing awareness to this crisis in our state. Thank you again to our panelists as well as our viewers tonight. See you later.